And you're welcome back. But just before we head on to the world of politics, let's talk a bit about health. Now, World Diabetes Day is observed on November 14th each year to raise awareness about diabetes, its prevention and also management. It was created by the International Diabetes Federation, IDF, and the World Health Organization. The theme for World Diabetes Day 2024 is breaking barriers, gripping gaps or bridging gaps. Diabetes is a chronic health condition that occurs when the body cannot effectively regulate blood sugar levels. There are two main types of diabetes, type 1 and type 2. Type 2 diabetes develops when the body becomes resistant to the effects of insulin or when the pancreas does not produce enough insulin. Now, this is often associated with lifestyle factors such as obesity, poor diet, and lack of physical activity. And now to speak more on this and the significance of World Diabetes Day, we're joined by Dr. Blossom Maduafokwa, consultant public health physician and PRO, Association of Public Health Physicians in Nigeria, Lagos branch. Dr. Blossom, you're welcome. Thank you very much for joining us this afternoon.
Thank you so much for having me.
You're welcome. Now, how can we break down societal barriers and stigma surrounding diabetes and also promote a more inclusive, more supportive environment for people who live with that condition?
Okay, great. So some of the ways that we're breaking these barriers is, for example, celebrating a day like World Diabetes Day. And we use a day like this to highlight the causes or the risk factors associated with diabetes, and also to highlight things that people can do to protect themselves or to prevent diabetes. And in addition, we use a day like this to also showcase individuals living with diabetes, basically to show the people, our communities, that there are people that actually live with this disease and are managing the disease quite well. So that way we break down the stigma and also make our message more accessible for everyone.
Okay, so Dr. Blossom, let's also find out the most effective ways to bridge this gap between healthcare providers and also patients in diabetes management, particularly in low-resource settings.
That's a great question. Because in a setting like, for example, like Nigeria, we suffer from poor access to healthcare, particularly for individuals living below the poverty line. And in fact, most Nigerians. So poor access to healthcare is extremely, it's a huge issue that we're trying to combat. So one of the interesting ways that we're trying to bridge this gap is by introducing something called self-care for diabetes. It was introduced by pioneered by the World Health Organization a few years ago. And basically what this means is we teach our patients, our communities, how they can care for themselves so that you don't have to go to the healthcare facility or see your healthcare provider for every single issue. So there are things that individuals that are living with diabetes can do on their own. For example, there's something we call foot care. They can take care of their feet to ensure that they don't have foot complications from diabetes. They can manage their diet. They can monitor their sugar levels, and they can adhere to their medication. So that way, they don't need to see healthcare professionals as frequently as usual. For example, in a country like Nigeria, we're about 1 doctor to 10,000 patients, and that is even in urban areas. In rural areas, the disparity is quite marked. So introducing self-care for diabetes is one of the strategies that we use to ensure that people can actually manage their conditions without having to see a health care provider.
Now, Dr. Blossom, I'm hoping you'll be very summarily in your next response, but I wanted to find out about research. How much attention is being given to research when it comes to diabetes, noting that Nigeria has a large number of individuals who live with this condition?
So there's a lot of research that has gone into diabetes. I mean, let's not even forget that, for example, insulin, one of the medications for diabetes, has been around for over 100 years. So there's a lot of research that has gone into diabetes management. The key question is, how much of the research are we implementing, particularly in our parts of the world where resources are low? So that's one of the key issues that we're trying to deal with. And that's why, particularly in our part of the world, we try to focus on prevention. That is, try to prevent people from even developing diabetes. So things like proper nutrition, things like physical activity. These are things that can help to sort of prevent the onset of diabetes or even delay it. So we focus a lot on prevention because access to management or treatment of diabetes, some of the new things that have come up, particularly in parts of the West, some of these things are not readily available to our communities.
Well, Dr. Blossom, I want to say thank you very much for joining us this afternoon to give us very good advice regarding that, and as we commemorate World Diabetes Day. Thank you again.
Thank you so much for having me. My pleasure.
Yep.